So our gums bleed because they're inflamed, because something's there making the body go, why is this? Something's there and I need to respond to it right away. So it is inflamed. There's inflammation of the gums that causes the gums to bleed. So there's many things we look at when we look in the mouth. So what do you guys see when you look at this picture? What's the first thing? Besides, I now see chipped teeth, but what do you guys see? So when we look at the gums, there's many things we look at. So we look at the color, when we look at the texture. So if you look on the top jaw, you can see that it's almost like an orange peel texture, we call it. It's called stippling. So that's and the tissue there looks flat, right? But when you look on the bottom, you see how the gum is swollen, and you can't really see those little dots in the tissue. So again, that indicates not healthy, not inflammation. We also measure the gums, and we also check bone levels, and then we also check tissue levels. So when we check bone levels, we check on the x-rays. And so we also check how is the person's oral hygiene. Do they do a good job? Or is there areas that they're missing? Because that will give us a clue of why this area is always really unhealthy. So there's also other contributing factors of why the tissue will be swollen. So sometimes people will come in and they'll have a really clean mouth and the tissue will be healthy, but they'll still measure, the measuring will be deep. And that's sometimes because of medication, or they have a systemic disease, or something's going on. Okay, so just touch base on what's normal. So as I said, we measure the gums, and they talked about the color and everything. So we want to have everything that's light pink. We don't want to have red. We don't have purple gums. Tissue at the top, so close to the tooth, it's called gingival sulcus. So that's where we measure, and that gum is not attached to the tooth. That's when you actually have to, when we talk to you about flossing, you have to go underneath the gum, because you got to clean under there, because that's where all the bacteria is stuck. And then the rest of the tissue is attached to the bone. So that has to do more, we look at that when the gums move down because of gum disease, and then now you have a root exposure, and then you have recessions, and then that's when we look at other tissue and bone levels and all that. So we talked about, you have to have a tooth to have gum disease, right? Because the bacteria has to attach to the tooth or be on the tooth. We have bacteria. So in my chat group, we talked about certain kinds of bacteria. There's specific ones that cause gum disease and specific ones that cause cavities, right? We have to give the bacteria food to make the byproducts. So actually what really causes inflammation is the byproducts of the bacteria. And time. So it takes time for the bacteria to build up, and everybody builds it up, builds up the calculus with a hard deposit. Some people do it sooner, some people do it later. So that's why the interval of your cleaning, it really depends on your mouth. And host immunity and host response. So that's kind of ties back to our patient who has a systemic disease that will possibly influence how their gums are healing, what the gum disease is like. And the other thing that people don't know about gum disease is that it's cyclical. So there are periods of aggressive kind of inflammation and periods of rest. It's really important to stay on a specific interval if you do know you have gum disease.